Let's now focus on health, and the Ministry of Health, with support from UNICEF and WHO, is set to immunize all children aged 5 years and below against polio in 12 selected counties. The 5-day campaign kicks off in July 11th, that's today, and runs up to July 15th. This is an emergency polio response campaign by the ministry and its partners after the virus was discovered in the country. In a bid to stem the risk of the polio virus spreading across the country, the ministry is immunizing children in 12 counties it had identified as high risk. Our Mary Mwoki is now in Kajiado on this very important campaign. Mwoki, good morning. What's happening where you are?
Morning to you, Linda. We are at the Kajiado KCB grant. We are at the national launch of the polio drive. The drive is targeting 2.6 million children who are at risk of polio in the counties you've just mentioned, namely Machakos, Nairobi, Kajiado, Kiambu, Wajir, Isiolo, just some of the counties that are at high risk. Remember, this polio was discovered by Ministry of Health officials in March in Eastleigh, hence the emergency drive to try and step up the risk of children facing polio. Some of the guests that we are expecting here today is Director of Medical Services Jackson Kioko. We are also expecting Governor Joseph Olelenku and representatives from WHO and the UNICEF. And right now I'm joined by Eda Kapita, who is the, Eda Wakaba, who is the Chief Officer Medical Services in Kajiado County. And she's going to talk to us and give us a brief into just what we are expecting today and even as the drive kicks off. Good morning. Thank you.
Good morning.
Tell us your name.
My name is Eda Wakapa. I'm the Chief Officer Public Health and Sanitation in Kajiado County. And today we are here to launch the polio mass drive, vaccination drive in Kajiado County, as well as 11 other counties in Kenya. Again, these are high-risk, considered high-risk counties in terms of polio. So that's our goal today here, to launch the drive and initiate the mass vaccination process, which will start today all the way down to Sunday. And then the second time around will start towards the end of the month, the 29th to the 4th of August.
Okay, what numbers are we looking at in Kajiado County?
About 150,000 children under 5 years old will be targeted. This will be something that will be done door to door, from home to home. We'll also target schools, especially if we have children under 5 who are in schools and may not be captured in the homes.
Okay. We know that some of the counties that have been mentioned to be at high risk of polio outbreak, we have challenges such as maybe religious or cultural beliefs. Do we have such challenges in Kajiado?
I believe if we look at Kajiado as a whole, it's a pretty diverse county. We have the urban populations in the towns, in the sub-counties that border Nairobi, but we also have the very rural areas, and I think one of our challenges in Kajiado will be reaching to the very hard-to-reach areas in the very remote parts of Kajiado. So in terms of religious and cultural differences or beliefs that may factor into vaccination use, I think that is something that our vaccinators, people have been trained on how to address the issue of beliefs and educate first, because if you have an informed consumer, I think you have a better consumer. So it's also our duty to educate the community on the importance of the polio vaccine.
Okay, Kajiado is a very vast county, and I understand that some areas are really far-flung. So how do your officers intend to reach these areas that are really far removed from maybe the general infrastructure as it is?
So for the last month or so, we've been having trainings, and we've also involved a lot of stakeholders, be it our local NGOs. We also have the community units in each of these local areas, so that you're able to, again, reach people where they are at home, despite the distance. So the vaccinations have been taken to different facilities in each sub-county, and will be sourced from there, if you will, to be able to reach all the remote areas.
So who are some of the partners you're working with in this drive?
So UNICEF is our main partner. Then we have WHO. We also, those are the two main partners. Okay. Yes.
In regards to Kajiado and maybe generally in the other counties that have been categorized as high risk for polio outbreak, what would you say is the greatest challenge?
One of the things that the polio virus is really passed through the fecal oral route. So there's a bit of issue of sanitation, clean water, clean hygienic practices, nutrition. So we also need to factor those in terms of prevention, because I think the key, as much as we are vaccinating, we really need to really think about how are we preventing the polio outbreak. So we need to really encourage and teach our communities on sanitary processes, hand washing, something basic as hand washing. So that's, I think, some of the things that we need to approach and continue on doing post the vaccination campaign.
Thank you very much, Eda. That was Eda. She's the Chief Officer, Public Health, Kajiado County. So, Linda, that is what we're expecting today. Remember, it's an exercise that's going to be running for the next 5 days in the counties that we've just mentioned. And it is really something that we shouldn't be talking about in this century. Remember that WHO just a month ago was pushing the president to declare it an emergency for the next year or so that medical health and other services can just come in and try to curb the outbreak of polio.